Good morning.
Good morning.
I skipped the mimosas and the Bloody Mary because if I do that, I tend to preach a little longer, pray a little longer. At the age of 40, I thought I was getting old. Then our children turned 40. It was then I knew with their children I would be forever young. Human life, that which has been built for service, is not so much about age as it is growth. We're reminded by God that there are those who plant, there are those that water, and I add spread fertilizer, but it is God that gives growth. On this 40th anniversary celebration of Methodist Hospital Northeast, we celebrate being forever young. Let us pray. Most gracious and eternal God, we give you thanks and praise for the visionaries, architects, construction workers, employees, for all the laborers, some of which did not live or stay to see this day, and yet are part of its service history. A place of healing, where those seeking shelter from hurts and pains, and yes, those seeking shelter from the darkness of night or the storms of life, may this place, through faithful service, stay and be forever young. In the name of the one true God we pray. Amen.
Thank you. That was beautiful. And thank you so much for everyone who is here today. I've had many comments about it, but what a wonderful turnout. We are so blessed to have the amount of support for both our hospital and really for our community and surrounding communities. So thank you again. I'd first like to start by recognizing a few very special guests we have here today. Live Oak Mayor Pro Tem Bob Tolgreen. Thank you. Bexar County Commissioner Tommy Calvert. The Honorable Judge Peter Sakai, our State Senator Jose Menendez, and we have esteemed mayors from our local communities who are all very supportive of us here in Live Oak. Universal City Mayor Tom Maxwell, and Selma Mayor Tom Daly. Thank you. We also have members from the Greater San Antonio Chamber of Commerce, the Tri-County Chamber of Commerce, and the Chamber, which serves Schertz, Cibolo, and Selma areas. Thank you. As I was conversing with a few of you today, we were really reminiscing about the hospital's origins, but most importantly, how these communities come together to support the growth in the Northeast Corridor. It's something that I haven't seen anywhere else in my career, and I'm constantly impressed by the level of support we're able to receive, not only from Live Oak and San Antonio, but from all of the surrounding communities, so thank you. I'd also like to introduce some of our system leadership, starting with Dan Miller, CEO of Methodist Healthcare System. Jamie Waslowski, CEO of Methodist Healthcare Ministries. And members of our board, including Dr. Michael Lane, Chair of our Governing Board. And Ashley Hickson, Chair of our Community Board. Thank you both for being here. Thank you for not only your presence today and for your ongoing support. From its earliest days, this hospital was envisioned as a place that would bring exceptional healthcare services to the growing Northeast Bexar County. For the last 40 years, that has remained our mission, to serve the people of this wonderful community. Our origins date back to 1980s, when civic leaders and elected officials recognized the need for healthcare services in this area. It was not without its challenges, including an initial denial of certificate of need, which many of you know does not exist at the present day. But the people of this community spoke up. They wrote letters, they made calls, even wrote editorials in the local newspaper talking about the needs of the people of this community and how this project would serve those needs. The project was finally approved in late 1983, and in 1984, construction started. Just 13 months later, the hospital opened June 15th, which was yesterday, but in 1985. Now, if only construction could go that quickly these days, we wouldn't have what 35 looks like, and our new tower would already be open. But it's remarkable what this community was able to do, to come together and quickly serve the growing needs of the Northeast communities. One of the most transformative moments came a decade later. In 1995, it was the landmark partnership between HJ Healthcare and Methodist Healthcare Ministries. This new partnership brought new leadership, a ton of resources, and a new faith-based mission that strengthened our community and the healthcare services that we provide, our commitment to high quality care. Since then, Methodist Hospital Northeast has continued to grow. We've added services, added rooms, and as you'll hear, we will continue to do that to meet the growing needs of our community. As we look ahead, our future is bright. It is my pleasure to invite someone who's been a steadfast advocate for this hospital and for our community. Mayor Pro Tem, please join me.
I have to say, what an honor it is to be here this morning. 40 years. It wasn't that long ago, back when I was in high school, just down the street, that I'd be up on top of the roof watching Judson 4 Theater. And look at us now. Who would have ever envisioned? But with that, we have to say, truly, over the 40 years and watching this facility grow and the impact it has on just the community, the region, and its commitment to health. And the expansion and growth that we've got that's been planned and that's already being executed, we really, truly look forward to that and embrace it, because we are at a perfect point. And as mentioned before, just hearing the fact that the initial permits or the need was not even denied, look at us today. Absolutely, there is the need. I can say personally from me, not only as a resident, but as a community leader, but also just as a patient under the care of Northeast Methodist, that this is truly an iconic facility, and we look forward to that. So there's much more that I can say, but I'm not going to, because I've been given a microphone, and that's dangerous. I've learned in my 15 years in this position. But I do want to share on behalf of Mayor Dennis, who could not make it here this morning, but she truly would have been here if she could. But she did send a proclamation that I'd like to read and present. Proclamation for the 40th anniversary of Methodist Hospital Northeast. Whereas, Methodist Hospital Northeast was established 40 years ago with a commitment to delivering high-quality, compassionate health care to residents of Northeast Bexar County and the surrounding region, a mission it has upheld with dedication and excellence for decades. And whereas, situated proudly in the city of Live Oak at the intersection of I-35 and Judson Road, Methodist Hospital Northeast has grown in step with the region's rapid development, enhancing and expanding its facilities to meet the challenging healthcare needs of residents across Bexar County, Guadalupe, and Como counties. And whereas the hospital has been a cornerstone of the Live Oak community, contributing significantly to the local economic growth by creating jobs, drawing top-tier medical professionals, and investing in healthcare infrastructure, and strengthens this entire area and region. Whereas Methodist Hospital Northeast has earned widespread respect and its compassionate care and dedication to its mission of serving humanity to honor God by providing exceptional and cost-effective health care that is accessible to all. Whereas the celebration of the hospital's 40th anniversary represents a meaningful milestone in its enduring legacy of service, innovation, and community care. Therefore, be it resolved that the City of Live Oak does hereby proclaim June 16th, 2025 as a day of recognition in honor of the 40th anniversary of the Methodist Hospital Northeast. Therefore, Mary Dennis set her hand, caused the seal of the City of Live Oak to be effective on this date, the 27th May of 2025. And we'd like to present this to you, actually, not mine.
Thank you. And Mayor Dennis has been such a huge supporter of myself personally and also the hospital. So we appreciate you being here in her absence. Thank you. It's my pleasure now to introduce another dedicated public servant and someone who is a strong advocate for the healthcare needs of Bexar County, Commissioner Tommy Calvert.
Well, lordy, lordy, look who's 40. I am so excited about today. It's truly an honor to be here with Senator Menendez and Judge Sakai. Bob, thank you for serving as Mayor Pro Tem so well. Ashley, great to see you. Thank you, and Doctor, for your service on the board. And certainly, Jamie, and thank you all at Methodist for all of your leadership. Pastor, thank you so much for the invocation and the blessing. I am a Methodist minister's son, so I felt very at home with that blessing. Thank you very much. I think, and Jerica, thank you for stewarding the next decades of service here, and we look forward to the future ahead, working in partnership with you. As we mark the 40th anniversary of Methodist Northeast, it's a place that's become synonymous with care, compassion, and commitment in the region. Since 1985, this hospital has been more than a medical facility. It's been a lifeline of families across the Northeast. And I think, and I would be remiss, that's why Mayor Maxwell and his wife are here. Mayor Daley, that's why you're here. That's why the chamber's here. You are that lifeline for so many of us. Back then, as was described before, this community was rapidly growing, but the infrastructure had not caught up with it. Methodist Healthcare stepped in, as you've done so many times, and not just with resources, but with vision. And you've never stopped stepping up, and that's emblematic on the signs that we have here today. You understood from the beginning that healthcare is not just about treating people when they're sick, it's about building a foundation for a healthier community, for a stronger community. So today, as we unveil the plans again and recognize a $146 million expansion, we're not just talking about bricks and mortar. We're talking about the creation of 78 private rooms. I just got a chance to see one where the medical care is enhanced because of that kind of privacy. And it'll offer more dignity and comfort to all of the patients. We're talking about new medical office space and a burgeoning medical center. I love what's happening now. You look at Gordon Hartman with the Multi-Assistance Center for those with disabilities and CRIT, and you look at what we're doing at university and what you're doing at Methodist. And by the way, I have 2 doctors here, so don't tell university. I have 2 doctors here at this hospital that I come and see. But you are investing in more than proximity to all of us in our community. When you bring this state-of-the-art care closer to home, you're changing lives with the response times. For the working mother in Universal City, it means she doesn't have to sacrifice a full day's wages just to access treatment or a checkup. For an elderly resident in Converse, it means urgent care is just minutes away. For the child in Selma, it means school-based care that keeps them healthy enough to learn and grow. And that's important because Northeast Bexar County is one of the fastest growing regions in the United States, not just in our region. Cities like Live Oak, Selma, Converse, Schertz, Universal City are seeing record population growth. And that means growing needs for healthcare, for schools, for transportation, and especially healthcare. Methodist Healthcare has anticipated this growth and is responding with consistent investment. From outpatient surgical centers to today's expansion, they've made sure this community has care it can count on. I know they haven't done it alone. I want to thank all of the Live Oak Council for partnering with them to keep those permits going. Thank you, Ed, and everybody else on the council. As we plan for even more growth, we're looking for more partners to step up. Bexar County is doing our part up the road in preparing the new hospital near Retama Park, bringing added capacity to the corridor. It's a welcome development because we know that no one institution, public or private, can meet all the needs of a growing community. It takes partnership, it takes alignment, and it takes a kind of long-term vision that Methodist has modeled time and again. By the way, I'm a Methodist baby. I just had to say I was born at Methodist Hospital, so I appreciate you guys. One of the most meaningful partnerships I've had as a commissioner has been with Methodist Healthcare and Methodist Healthcare Ministries. Together, I couldn't be more proud of the work we did to transform the old abandoned Southeast Baptist Hospital and put the Dixon Clinic. I knew Bishop Dixon. I spoke at his church off of Highway 87 before his passing, and I came back for a celebration you all just recently had and learned about the investment that is ongoing, and we are so thankful. I just want to say that from the bottom of our hearts in our community. One of the first pledges I made as commissioner was to do something about the old Southeast Baptist. So it was divine, really, because, you know, in the covenants of Southeast Baptist, it said we can't sell to another healthcare institution. And so the fact that we got that done, I just want to say thank you for everybody who worked collectively to do things for the common good. That $10 million investment has brought that area back to life. And that Methodist, it's not just a clinic, right? It's not just a clinic. It's a place where people can get mental health care, their primary health care, dental health care. The community center is coming. All of those things are important for an area that really needs it. That project didn't just restore a healthcare gap, it restored faith in what's possible when we work together. It sent a message to the people of Pecan Valley and beyond. You matter. Your health matters. And this community is worth investing in. Throughout Methodist Healthcare Ministries, we've seen more than $1.6 billion reinvested into charitable and community-based care. I love that double bottom line method that you guys employ every day. It's incredible. There's nothing like it. Supporting school-based clinics, mobile health units, mental health programs, and even broadband expansion so that families can access telehealth services. These aren't short-term fixes. These are long-term commitments to breaking the cycle of inequity and creating generational wellness. And we saw just how critical that infrastructure was during COVID-19. Methodist hospitals were frontline responders. Methodist Healthcare Ministry mobilized over $1 million in relief efforts, from food and shelter to community outreach. They supported research that gave policymakers the data we need to respond effectively. They acted with urgency, with empathy, and with purpose. That's the kind of partner every county needs. One that doesn't wait for government to act, but works alongside it. One that understands that healing communities takes more than prescription, it takes presence. It's perseverance and partnership. So to that end, I've already told Ashley, my old classmate at St. Mary's Hall, that we're gonna get into one of my bootleg realtor tours. I'm gonna take you on another area in the Southeast that needs a hospital. And you know, I know a little something about finding these spots that will be both profitable, and so just come with me and we'll take you to the future too, okay? Yeah. So let's celebrate this 40 years of service here at Methodist Northeast. Let's also celebrate the values that brought us here, because they didn't have to do all these kinds of investments. The values that brought us here are important to celebrate. And let's recommit ourselves to expanding this legacy of care, not just with new buildings, but with investment in the people, the nurses, the doctors, all the technicians, in partnerships, in smart investments, and an unshakable belief in health equity for all. To leadership, physicians, nurses, and staff of Methodist Healthcare, thank you for showing up every day for those in need. Thank you, Jerica, George, for leading this amazing team. Thank you for being a partner to the community and a pillar of strength in the communities that need it most. Congratulations on 40 years, and here's to the next 40 years of healing and hope in Bexar County. Thank you.
Thank you, Commissioner Calvert, for your continued leadership and for championing so many initiatives that support the health and well-being of our communities. Now it's my pleasure to welcome another tireless advocate for our community, someone who deeply understands healthcare policy and that quality healthcare is essential to providing a healthy community. It's my honor to introduce the Honorable Judge Peter Sakai.
They tell me to be real careful. That's why I was like, okay, be walking real gingerly there. Well, good morning.
Good morning.
Well, thank you, Jerica, for inviting me to be here today as part of this historic occasion. I just this past year, we were all at the Methodist Westover Hills over in the greater Northwest, so to speak. with a new hospital there. And so we had a historic occasion, which I was proud to be here. And I just want to give this special recognition that this is just as special, if not more special, because you've been here and you haven't forgotten where you've been. And you've come back to make sure that the Northeast corridor here is going to be enhanced, not only with your presence, but your continued expansion to deliver medical care, health care, especially in the crazy times that we live in at this time. And so this is a very special moment. Senator Menendez, we were there too, and you're here over here at this part of the county. So thank you for your leadership. I know you came out of that legislature. You might have been a bit battered and bruised, but you defended Bexar County and you defended it well. And I want to give recognition to Senator Menendez for his leadership, especially in regards to issues of child welfare, health care, just for the basic needs for our citizens in the state of Texas. Thank you, Senator Menendez, and I'd like to give you a round of applause. I always like to recognize, and I know that Mayor Dennis is not here with us. She is quite a delightful lady and a longtime mayor of Live Oak. I also say, Mayor Maxwell, you're starting your term here as mayor of Universal City, and then there's the one and only Mayor Tom Daly from Selma. And as the mayors have always pointed out, you know, yes, I'm in the Northeast corridor, but they make sure to know what jurisdiction, especially Mayor Daly. You said, hey, you're in actually Selma right now, not Live Oak. Well, right now, I'm in Live Oak with Mayor Dennis, right? So Live Oak's in the house, and we want to make sure that I recognize. So thank you, mayors, because obviously y'all are all part of that Northeast partnership, which I have graciously been accepted into your group there to come out. I've spoken, and so we know that this is one of the fastest growing, biggest booming areas in the state of Texas, if not the nation. So we know that although the opportunities are great, the challenges to meet the needs of this community are even greater. And it's going to be very important that we're all working together. And I wanted to say thank you to Commissioner Calvert, because we are in Precinct 4, and that Bexar County, so long as I am your county judge, I want to make sure that all parts of this county are included into the strength and to the needs of our community, and that's my pledge to y'all. So thank you, mayors, for being here. What can I say about Methodist Hospital, Methodist Healthcare? Dan Miller, we go back in many conversations of how we recognize Jamie Wisłowski. You were there at one point, now you're over in the Methodist Healthcare Ministries part, and they're two separate entities, but they're just so intergrained with each other that you basically, nobody really knows the difference of what Methodist does for this. And for that, I just say thank you for their leadership, and I want to recognize Dan, I want to recognize Jamie, I want to recognize Dr. Valdez, because he said, Judge, would you please make an effort to come out here? So thank you, Methodists. Let's give them a round of applause for their leadership. Obviously, I'd like to recognize and congratulate everyone associated with Methodist Hospital Northeast for this remarkable achievement. 40 years of service is truly impressive and remarkable. You have anchored our community and positioned it for greater opportunities for improved economic development, economic mobility, and improved health outcomes overall. I want to applaud the Methodist hospital system for the $146 million expansion to this hospital and what is soon to be undertaken. I also want to recognize for the Bexar County residents who live in the Northeast corridor, this hospital is truly a lifeline. And we must always recognize how valuable we need to make sure that we have health care access to everyone in our community and the challenges that are yet to come. This section, as I recognize, of our county is rapidly growing with not only in population and economic growth, but again, in the challenges to meet the underserved and what we need to do to protect them. So let me thank again the mayors, Commissioner Calvert, for your leadership to make sure that the Northeast corridor is not forgotten, at least from the perspective of county government. Turning 40 years old, that's the big number here today, is a tribute to the doctors, the nurses, the administrators, every other staffer who works here through their dedication and loyalty is truly appreciated and admired, because that's what makes Methodist Hospital work. So thank all of you, the employees, from the top to the bottom. And would y'all please give them a round of applause for what they do. I'm proud to celebrate this milestone with you and to stand beside you as you build an even stronger community for our citizens. Here's to the next 40 years. Congratulations and God bless. Thank y'all very much.
Thank you, Judge Sakai, and thank you for demonstrating why local leadership is so essential for progressing the needs of our citizens. Now it's my honor to introduce a very well-respected voice at the state level. Please join me in welcoming State Senator Jose Menendez.
Well, good morning, everybody. Good morning. I've been very impressed with everything I've heard. I want to welcome, I think, Jerica, you said 12 months you've been here. Welcome on her way back to Texas via Las Vegas, I think I heard. And so, one of the things that I'm going to try not to be repetitive, but that I think about this Northwest Corridor, it's the way in and out. If you're going to Austin, and so many people commute to Austin from San Antonio. Austin's a hyper expensive place to live, so a lot of people choose to live, especially in this part of San Antonio. So we have a lot of travel in between the two. It's no surprise to me that we've seen this booming growth here in this area, in this Northeast Corridor. And the fact that we have all of the local leadership and the mayors and the city council and the mayor pro tem is testament to the fact that they have strong leadership that has caused a lot of this growth. I hear a Dick's Sporting Goods is on its way soon, and I know my wife likes the IKEA. But today we're here to celebrate the fact that 1,000 people work here. Think about that for a second. 1,000 people. As I was speaking to Felicia, she was telling me, it's what a gift you have, Jerica, to have a COO who's a former nurse. Yes. Because, my mom was a nurse, and my wife unfortunately has had a lot of health issues and over the last 56 years, and the nurses make all the difference. Facilities are great, and it's good to have private rooms, and I think that's the expected norm at this time. And I think what you're doing is wonderful for the community. I think this expansion is going to be a $146 million investment. It's going to be critical investment. But all of these buildings are just buildings without the people. And that's the most important part. And that's what I love about Methodist Healthcare. It's not just Methodist, the hospital, the HCA-owned hospital, it's the ministries part. And for me, the ministries part is what gives it the soul. So Methodist, the hospitals, maybe the body, maybe the arms, maybe the functioning things, but the soul is Methodist Healthcare Ministries, because that's what helps the schools, that's what helps the people who need everything. Because these aren't going to just be these are people who are going to be embedded in our community. And this new tower is going to be the culmination of all the expansions that this hospital has experienced in the last 40 years. It's going to demonstrate to our community, to this Northeast Corridor, what Methodist Healthcare brings in high quality care and true public service to the area. So I join my colleagues. I join everybody here in congratulating you. We have a resolution that we brought down from the State Senate. I apologize to the mayors who are going to miss out on the sales tax of my every day that I drove by and stopped and either refueled or bought something. I commuted the first 3 months every day between here and Austin, and it wasn't fun, but it was better than living in Austin. And I did that the last 2 months, and I regret it. Yeah, but anyway. So as I look at this, and I'm not going to read this resolution, I just want to hit on some high points. You know, the fact of the matter is here, Methodist Hospital Northeast being part of the system that employs 12,000 people here locally. 12,000, think about it. Probably one of our biggest employers, including 2,700 doctors in all specialties. And over the last 10 years, Methodist Healthcare has invested $1.4 billion in the community, which serves more than 600,000 inpatients and outpatients. And you know, Commissioner Calvert, I know you said you were a Methodist baby. You're one of the many Methodist babies. But we have 3 Methodist babies that, you know, in our family. Well, 3 and just immediate kids, and then 2 others and grandchildren. So we got 5 Methodist babies in our family. So, you know, Methodist is a big part of our family. And so thank you to the leadership, to the board members. Thank you to the management that leads this organization. And thank you to all the elected officials who've taken time out of their time to be here, and to their spouses who helped them, allow them to serve, because I know that when the elected serves, the whole family serves. So thank you very much. It's a good day.
Thank you, Senator, and thank you for continuing to be an advocate for this area despite your many responsibilities. You've heard about Methodist Healthcare Ministries multiple times already this morning, and that's one of the most beautiful parts of being a part of Methodist Healthcare, the 50-50 partnership between HCA and Methodist Healthcare Ministries. Here to share a little bit more about the ministries is someone who leads that mission-based vision with both vision and heart. Please welcome Jamie Weslowski.
Well, thank you, Jerica, and thank you to your entire team, not only your leadership, but your team members throughout Methodist Hospital Northeast. Thank you to our public servant leaders for being here. Thank you for all of your support. Thank you for your partnership. We can't do things on our own without that incredible partnership that we have with all of you, so thank you. And thank you, Dr. Lane, to Ashley Hickson, and all the board members that are here, board leadership. I really do appreciate everything. You know, it is an honor for me to be here today, because when I drove into town in 2007, when you were on the highway here on I-35, you could drive by this area. In fact, you did drive by this area and not know there was a hospital here. It was small, it was short. Ashley, way back when, was the chief operating officer. I think she was 22 years old at that time, and I was young too. But anyway, so it has come a long way, and the amazing things that Methodist Healthcare system is able to do for this community is incredible. I'm very proud to be half owner of Methodist Healthcare system. We'd love to see the progress that they are undertaking and moving on just each and every day. It's incredible growth. Methodist Hospital Northeast has gone from being an essential small hospital for this community when I drove into town to what I would say is more of a destination hospital. They've expanded services. This expansion that is about to go, you know, we're about to start, is going to make this hospital more and more of a destination for, you know, every part of San Antonio, every part of Bexar County and beyond. So I am extremely proud. We talked a lot about what we have done with the $1.6 billion that we have spent at Methodist Healthcare Ministries. We can't do any of that without the proceeds, the distributions from Methodist Healthcare. And I will tell you, that's only part of it though. The other part is that we take care of a lot of patients that are uninsured. These are people that are working hard, they're low paid, so they make too much to be eligible for Medicaid, and their employer does not give them insurance. So they are truly, unfortunately, in a situation where they do not have insurance, in spite of a lot of work that they do. And we take care of a lot of those patients at Dixon. The commissioner talked about that. At Wesley. We also have a school-based center on the Northeast side in shirts. When we have to send our patients to a higher level of care, Methodist Healthcare has worked with us with 250 specialists that will accept our patients. They will accept our patients for Medicare allowable rates. So if you're not in the healthcare business, that basically means at best they're doing it for cost. They're not making money off of our patients. And a lot of these physicians will accept our patients and take care of them for nothing as part of their special mission. So that's incredible. Methodist Healthcare then accepts our patients for admission, for surgeries, for diagnostic testing, things of that nature. So we are able to take care of this population. And Methodist Healthcare has provided over $700 million this past year in charity care. So they are truly a great safety net for this community. And what does that mean, $700 million? That is charges, but that equates into $100 million of actual cost that they are donating into this community. And there aren't too many businesses, I don't think you can find, that are donating $100 million out of the goodness of their hearts into this community. So anyway, it's a great, great partnership. Methodist Healthcare Ministries here in the Northeast community, we support several clinics, the school-based center up in Schertz that I talked about. And most recently, we partnered with Central Med, a great federally qualified health center here in San Antonio, another one of our great partners, and the Northern Hills United Methodist Church to open a new ministry center. So Central Med provides the health care. We supplement them financially to do that, and we set up social determinants of health type buildings next to that. So we're able to provide food for 800 families up on the Northeast side and 29 pounds of food per month, in addition to the diaper bank, in addition to other things. So we're really, really proud of all that. So on a day like today, as we celebrate a thriving hospital, a hospital that's going to even thrive more in the future, that is Methodist Hospital Northeast. We're all deeply inspired knowing that the good work doesn't stop here with the life-saving, essential, and expanding care. It extends far beyond the walls of this hospital, and for that, we are very, very grateful. So thank you for having me, and God bless all of you.
Thank you, Jamie. And we have new employee orientation every Monday. Usually they're here in this room. And much to HR's dismay, I asked that they relocate for today only. And I said, look, it only happens once every 40 years. It's okay. So as I visited with our new employees this morning, one of the things that we asked them is why they chose to work here at Methodist Hospital Northeast. And some of the other senior leaders who are in the room with me today were in that room this morning.